Okay, let's go now with general concepts on the many joints in the human body. Joints are necessary for movement, and they may articulate two bones, cartilage with bone, or even a tooth with its bone. Here we have two different disciplines important to chiropractors. While arthrology studies the characteristics of a given joint, kinesiology studies the movements of that joint. Not only in anatomy you learn these disciplines, they are also essential in technique and along the whole program of studies. To start, and this is confusing to some students, joints can be classified by their structure but also functionally. So after the structural classification, joints may be fibrous, cartilaginous, or synovial, while after the functional classification, they can be synarthrosis if they have no movement, amphiarthrosis if they have little movement, or diarthrosis if they can move freely. In a fibrous joint, there is not synovial cavity, and two bones are attached together by fibrous tissue. This type of joint have little or no movement, so they belong to synarthrosis or amphiarthrosis, functionally talking. Fibrous structures like the ones among the skull bones are considered synarthrosis in adults. Fibrous syndesmosis is where a ligament holds two bones together, like in the case of the ulna and the radius of the forearm. It has little movement, so it's also an amphiarthrosis. Agomphosis is a very special joint only found in the mouth, where a ligament attaches the teeth to the bone, and of course it has no movement, so it's a synarthrosis. Then we have cartilaginous joints who don't have synovial cavity either and permit, again, slight or no movements. They include synchondrosis, where hyaline cartilage holds the two parts, like in the articulation of the ribs with the costal cartilage, and symphysis, where we find fibrocartilage holding the two parts. This is the type of joint among the vertebra or the two hip bones meeting in the pubis. And finally, we have synovial joints. These are the only ones to have a synovial cavity surrounded by a joint capsule that allows a great range of motion, so they move freely. They are diarthrosis. These joints are so complex in structure and function that they deserve a chapter in their own. So let's quickly see a table with everything we just reviewed and move to the more complex synovial joints. Okay, so here you have the table. Remember, you have all these slides in the VLE, so you can review them carefully as necessary. And okay, let's go with the synovial joints. So here you have a parasagittal cut of the elbow joint showing the main characteristics of a synovial joint. As you see, the surface of the bones inside the synovial space are lined with hyaline cartilage that reduces friction and acts as a shock absorber. That synovial space is enclosed by the joint capsule because there is liquid in there and you don't want it to leak around. Always remember that these are 3D structures, so use your imagination to visualize them as they really are. The joint capsule completely surrounds the synovial cavity and attaches at the peripheral boundary between the hyaline cartilage and the bone. It has a resistant external fibrous layer that sometimes gets so thick that forms a ligament. but it also has a delicate internal synovial membrane whose function is to produce the synovial fluid that you will see is for nourishment and lubrication of the joint. The synovial fluid produced by the synovial membrane contains hyaluronic acid. If you ever heard about joint infiltration technique, is very used in professional sports, and what they do through a needle is to rinse the inside of a painful joint with hyaluronic acid. Synovial joints also have ligaments that their function is to limit the movements of the joint so it doesn't suffer luxation or dearticulation. Ligaments can be intracapsular or extracapsular. Another device synovial joints can have are discs or meniscus. They are placed among two bones of different shape and are attached to the inside of the capsule by their edge. Alright, so all structures in the body need a nervous and blood supply. The joints get branches from the surrounding muscles, the muscles around the joint. They receive a nerve so they can move, so they give branches to that joint. The capsule and ligaments have pain and sensory receptors which send inputs to the brain informing of the position of the joint and whether it's being damaged in some way. On the other hand, blood is essential to bring nutrients and oxygen to the joint. Branches from neighboring vessels are responsible of that blood supply. But cartilage is a special tissue that has no nerve, so it is painless when damaged. Alright, remember this. It also lacks blood supply. Where there is no blood supply, whatever tissue doesn't have blood supply, inflammation is impossible, and repair of cartilage after an insult is also very difficult. Cartilage is nourished by the synovial fluid generated by the synovial membrane of the capsule. Alright, other specializations. Bursa are extensions of the capsule with synovial liquid inside that help reduce friction among different structures when the joints move. Other protective structures are tendon sheaths around tendons running through narrow places like the wrist, for instance, all the tendons going from the forearm to the hand. Bursa, fibrous capsules, and synovial membranes may suffer damage, swell, and cause pain, as you see in the green box. They have specific names. The ending itis means inflammation. Okay, so you know that synovial joints have a great range of motion, but different joints produce different movements. So let's see which are those possible movements. Okay, first, the movement of a joint depends in its architecture. Here you have a representation of the 6 different types of synovial joints. We will review them as we get to them during the semester, but by now let's see now how they can move. First is gliding, which is a very simple movement where 2 flat surfaces move in relation to each other. An example are the 8 bones in your wrist. Then in many cases, two bones move, changing the angle among them. These are angular movements that include flexion, extension, and hyperextension. Here you have some examples of flexion, extension, and hyperextension of the leg, the forearm, the arm, the thigh, and the hand. Again, get familiar with all these movements. Abduction is a movement away from the midline, while adduction is a movement towards the midline. I know they sound very similar, so don't get confused with that. When we combine flexion, extension, abduction, and adduction, we can produce circumduction, which is a complex movement that requires condylar, saddle, or glenoid joints. We will see that as we get to those specific joints. A very particular movement is rotation along the axis of a bone. Here you have these movements. In the case of the hand, you have to differentiate abduction and adduction of the fingers in relation to the midline of the hand itself. And what is abduction and adduction of the whole hand in relation to the midline of the body in anatomical position. You can see that in the right. Okay, so on top you have the abduction of the fingers, adduction of the fingers, and in the bottom at the right you have abduction and adduction of the hand in relation with the body. When the anterior surface of a limb bone rotates towards the midline, that movement is named medial rotation. If the anterior surface rotates away from the midline, the movement is named external rotation. Then we have some parts of the body that can do special movements, and these include elevation and depression, protraction and retraction. Here you can see them in the image, represented by the mandible. Here we have other special movements like inversion, when the sole of the feet face each other. Then we have eversion, when the soles move away from each other. And dorsiflexion and plantar flexion of the foot. Alright, so these are special names for what the foot can do. Supination, it is a movement of the forearm that makes the palm of the hand face up or anteriorly if you are in anatomic position. Remember, the anatomic position is with the palms facing forward. Okay. Then we have pronation, which is the opposite movement of the forearm, so the palms face posteriorly. And then we have a very special movement which is called opposition of the thumb, that moves across the palm to touch the tip of the fingers of the same hand. Okay, this is considered a human exclusive movement. Okay, that we think it makes you human. Okay, because it allows you to do special movements that not other animal can do. And this is all for now. Here you have a table with all the possible movements of any synovial joint. With you think about examples of all these movements. Okay, great. Remember to get the Ackland anatomy videos. Okay, students from other courses probably have them, and start viewing them to become familiar with the anatomy of the human body. Okay, thanks for listening. We are heading to the spine.